and welcome to this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network, and joining us in studio for this session is Helena DaSilva Hughes, the Executive Director of the Immigrants Assistance Center in New Bedford. Thanks for coming in. You have been so busy the last, well, since this whole pandemic has started. It's been crazy.
Yeah, it's been very, very difficult.
How has, and I've asked most people when they've come in, just the workflow at the Immigrants Assistance Center right now, how are you doing? Is it remote? Is it, because you're still getting people, and especially at your place, it is for the most part, it's a face-to-face operation.
Exactly, it's a direct service organization, and so on March 16th, the building closed down. And what happened was we knew right away that we were the lifeline to the immigrant population, and there was no way that we were going to go home and work remotely. I knew that right away we needed to be at least in the building and to providing services over the phone. And a lot of our clients, not only do they have the language barriers, that they had the technology barriers. So I'd say the first thing we started to do is we have out of about 12,000 clients that we serve, that's just heads of households, that's not families.
Right.
What started to happen was we knew that approximately 3,000 of them were non-English speaking elders who were illiterate in their own language. And I think it's important for people to understand the fact that a lot of them have been here for a very long time, but they never learned how to speak English is because a lot of them have very low literacy skills. Some of them have less than a third grade education, if that. So it's a population, there's a lot of hand holding, and we knew that they were going to be very much at risk, especially our elders. So what we started to do right away, started to reach out to them and started making wellness calls. Well, we started doing that, and the next day we had an elder who was about 84 years old, a gentleman, show up downstairs at our door, because our building was closed, in his pajamas, crying because he wasn't feeling well, and he lost our number. So he walked 2 blocks to our office because he wanted to make sure, he wanted to talk to us because we needed to call his doctor. So we called his doctor, we provided services, we went to his house, picked up medication, dropped it off at his door, and so that was just like reinforced that we definitely needed to be there. So we started really working with our elders, making wellness calls, making sure at that time too we were getting produce, so dropping off produce at their homes, and then we knew some of our families, the technology barriers. So a lot of them were the first time getting unemployed because they needed to help apply for the unemployment insurance, so we started helping them with the unemployment checks, so trying to do that online with them on the phone. So that was very, very time consuming. We knew there was a lot of things that needed to be done at a state level because some of them had green cards, they were legal residents, but their green cards had expired, and so he wasn't letting them to go through. So we worked very closely with Representative Cabral at the state level to make sure that those challenges were being, that we were able to resolve some of those challenges. A lot of our families, we know that mixed immigration, which means the parents have no immigration status, but they have children born in the United States, and we know that those families did not have access to stimulus, they don't have access to unemployment, so we knew that was definitely a population that was very much at risk.
So you had to keep, in a sense,
we pivot kind of our services instead of being
it's changed, and I mean the one thing that I keep thinking off the top is, I mean, as and you've done this for a long time.
38 years.
Now you become a health expert, or learning the health system. So you're learning as much as they are, because with all the issues you're facing, dealing with a pandemic probably wasn't on top of your list for a long time.
Yeah, none of us ever thought that this was going to happen, so we had to pivot our services, but at the same time, we were in the middle of a pandemic and trying to explain to them, right, at the beginning when we first had the testing, right, there wasn't enough tests. So what we were telling people to stay home, unless it's an emergency, but to stay home. So I'm sure there was a lot more people with COVID that would never had the test that we don't know today, right? So for a very long time, it was like stay home and don't go to the emergency rooms unless it's an emergency, but the importance of testing. So then Stop the Spread came, which was great because now we can really get people to get tested. So we basically worked with everybody. Our health department, Damone, has been absolutely amazing. We've been working very close to Damone Chaplin at the health department. We work closely with Seven Hills, who is doing the Stop the Spread. We worked with South Coast Health, the mobile van. So we were working with everybody who was doing testing.
Right. Did you find that the population that you were working with, did they, I don't want to say believe, were they hesitant about the virus? Did they adhere, do you think, to the guidelines that had been established when you were saying wear the mask, social distance, stay home? The reaction that you got was what?
The reaction that I got, I'd say the elders were the ones that really, I feel, that really complied. And we understood, because we heard stories about them not seeing their grandchildren and not families, and now we see now that they've got their shot, that they are seeing that. So I would say the elders were mostly the ones who complied. I would say a lot of the families, it's very traditional, no matter what ethnic group you are, if Portuguese, Cape Verdean, or Spanish, to get together with family members, right? And I have to say that some of it continued, and even at the churches, right? We know in New Bedford, right? An example, there was a church in New Bedford that was not compliant, right? So that became a huge challenge. And so it's like we worked a lot with the ethnic media. I do a lot of work with the ethnic media. So we were working very closely with WJFD-FM, the Portuguese channel. We did the Voice of the Immigrant. We did some work with Telemundo out of Providence for the Spanish population, and the Cape Verdean radio station out of Brockton for our Cape Verdean community. So I was constantly working with the ethnic media to use that as a tool to provide education and to make sure that they're following the CDC guidelines.
And communication, I know, has been an issue, and because you were even talking about it too before. A lot of stuff is online. A lot of stuff is available in the palm of their hands, but as you said, a lot of them don't know how to use it.
That's the problem, exactly. So we always knew that technology barriers, aside from language barriers and cultural barriers, technology barriers was huge. We always knew that, to the point that we were just in the process of having, in our ESOL classes, we were going to have a computer lab. And then COVID hit and everything just put a stop to that. But yes, we know that, and it became very obvious with our population that the technology barriers, right? And we haven't even started talking about what's happening in the schools.
I was going to say, it translates into the schools too, because you've got so many kids, and I see it from my personal standpoint too, is that there's a lot of people that just don't have Wi-Fi or the technology they need. Although I think New Bedford did a pretty good job of dispersing laptops or whatever to kids, because I know they did that, but Wi-Fi was an issue.
That's right. And helping, I know as a parents who speak English are having a hard, I hear them all the time.
I don't even know if it's a minority issue. That's an every issue for parents.
But can you imagine adding another layer?
Correct, yeah.
Right? The language and the technology barriers of people who can't, families who can't speak the language, and how are they helping their kids? They're not. And so a lot of these children, what I always worry about, what's going to happen to the pandemic, we're going to see a huge impact that it has on children. And if you start looking at English language learners, that gap is going to be a lot larger.
And that's what they're saying too. That's why getting back to in-person school is so important, that they want, but you've already lost that year.
That's right, a whole year.
And it's crazy. I mean, I think, I look at it, and I think New Bedford's been pretty aggressive. I know they've had remote or hybrid learning for a while now, which is better than some schools, which are just all remote.
Exactly.
And the Catholic schools, and the Catholic schools have been in. But that costs money too.
That's right. I just think this pandemic really brought a lot of these challenges to the forefront, and I'd say technology barriers, as we already knew it existed, and it's escalated, and now everybody knows. Right,
and the hard thing with technology issues too, and we can move on from that, but the hard thing with technology issues is not so much a, quote, government issue, it's you need the technology companies to step up to provide that service.
Yeah, exactly. And so I think that one of the good things that happened is we've always collaborated with the New Bedford Public Schools, right? So I think that collaboration was so important, because a lot of times, like an example was at the beginning, we know that high school and middle school kids got the laptops or Chromebooks, but a lot of the kids on elementary school at the beginning were not getting Chromebooks. At that time, Senator Mark Montigny actually gave us a grant, and we were able to connect about 40 of our students that we had from our families that we knew were having all of these barriers with a laptop, right? And then once those children got the laptop, we connected to the schools and to the teachers whom we knew that had those kids in the classroom to make sure now, for example, now Johnny has a laptop, Johnny's on 3rd grade and he's at Gomes School, and this is the principal at Gomes School, making sure that those connections were taking place in the middle of all of this chaos.
Talk about just healthcare in general, because you talked about the gentleman that walked into your building, 84 years old.
Didn't walk into the building, he knocked on the door.
But I'm curious as to how you help, because there's HIPAA laws and stuff like that, but there's so many people that don't even go to the doctors, and now they've been impacted by that, and just learning the challenges of the healthcare system.
Yes.
And for those who don't speak English, it's even worse.
Yeah, so we are, aside from, I'd say that the Greater New Bedford Health Center has been a great partner through all this. Cheryl Butler has been absolutely amazing. So what we're doing is with the testing sites, it was very good that one of the great things about Stop the Spread was that it was easy and it was simple and there was no questions asked about their immigration status, social security numbers, or health insurance, right? So Stop the Spread was very, very simple. So making sure that, first of all, making sure that people were getting tested, even people who did not have the symptoms. So we did quite a bit of work with the fish houses, reaching out to the fish houses and making sure, because we knew that that was definitely where the high-risk population were at, and we wanted to make sure that they also had access to making sure they understood that they could be tested with no questions asked. So we work very closely with the fish houses to make sure that their employers were aware that this was an easy process, that they could be tested and no questions asked, and it was free.
Did you have a hard time convincing folks to get tested?
I would say that a lot of times, I would say that the biggest challenge we had about convincing people to get tested was a lot of them were afraid that if they tested positive, they were going to lose their jobs, and a lot of them, COVID, for a lot of the populations that we see, COVID was not the priority. The priority was to work. They came here to work, and they wanted to work, and that was their main focus.
So how do you balance that? Because ultimately, and we're still dealing with it now. I mean, you get out, people have to quarantine for 10 days or 2 weeks, whatever, 2 working weeks. Those 2 weeks versus the job, and for the most part, I'm sure it happens. I'm not going to be ignorant and say it doesn't happen, but for the most part, I don't think people are losing their jobs because of COVID. How do you convince them to get the test and say the jobs are going to be there? We're working with your employer.
But some people did lose their jobs.
Well, I know, that's what I'm saying. I'm not saying they didn't, but I'm saying I think that there are those still that you're dealing with where you can go get.
Oh yeah, because what I think it's important to kind of understand our population, right? So everybody thinks about immigrants, especially the undocumented. Well, there's a big difference. So our clientele, right? Let's look at who does the immigrant service. So we service, when we talk about 12,000, approximately 12,000, we're looking at 40% of them are Spanish speakers. Now the 40% are Portuguese speakers. Now the 15 are Cape Verdean, and the other ones are because we service everyone.
Right, yeah. Yep.
So when we look at that, we also have a population that we serve that are green card holders, that are people who have legal residence, who have status, who have a social security number, they're here legally, right? That population does not take much convincing about the CD guidelines, because they're working, they have a social security number. If they get sick, they can get or they can collect unemployment, or they'll have that. But then there's that population of mixed immigration that we see that is probably the highest risk right now. Is a population that they have no status, so don't have a social security number. A lot of them are working through temp agencies. So when we look at it, that population, if they get sick, they are not going to have the luxury, even though some of the fish houses, I'm not saying all of them, some of the fish houses were able to pay, but the problem is with the individual, they don't want to get tested, or some of them, they don't get tested, they don't even feel sick, but then they're spreading, but they don't a lot of times. And then what's happening is, when we talk about this particular population, we're looking about 5, 6, 7 people living in a household, right? Why? Because they're sharing expenses. And so it's kind of, so if one person gets COVID and they're living with 7 people, chances are, a lot of times, people all get COVID. So the whole thing is that even though we talked about, and I did a lot of work about making sure that the quarantine and how, like in New Bedford, there was the Holiday Inn in Taunton that people could go to get quarantined. Trying to convince people to get quarantined did not work because they needed a job. So what happened was we would hear from clients that first, second, and third floor of the whole house, because as we know, we have 3 deckers.
Right.
The whole place was infected with COVID.
That's just, it's got to be frustrating.
And it was very frustrating because, and that's why I think that not just, we did a lot of work with the ethnic churches, because we figured that if we get everybody on board, so I spoke to Our Lady of Guadalupe, St. Anthony's, Mount Carmel, Our Lady of Assumption, right?
Yep.
All of those churches about making sure that they were televising their mass. During their mass, I spoke directly to the priest to make sure that during their mass he would speak about the importance of testing.
Yeah.
So then what we did is because we were already working with the partners like Seven Hills, like for example in South Coast Health, and then getting the testing to happen at the parking lots of the churches.
Yeah.
Because it's a safe place, there's trust, and then if you have the priest of these ethnic churches telling them that there's going to be testing available, it's a familiar place, and that's where I feel that we were extremely successful. There's a sort of like a blueprint of how we did stop the spread, and I keep talking about that same blueprint. We can do it for the vaccines once we get enough vaccines.
Right. You touched housing, and I've read, I mean, housing's been such an issue during this thing, especially for probably your clientele. Those that aren't working, they got to pay rent. They got to be, so you've got the COVID issue where you just talked about the buildings being infected, but at the same token, they have no place else to go.
That's right. That's right. And sometimes they don't even know who the landlord is, because if you have 7 people living in a household, there's only one person that might have status.
Legally,
no, that might have status. Either might have DACA, or they might have TPS.
Right. I mean, so they'd be the leasee, if you will.
They would be the person that would speak to would know who their landlord
Yep.
is, and that became like, so. One of the heavens sent that I can say that during this COVID is we had Community Foundation, or South Coast Community Foundation, that really came to our aid and said we were able to get funding to help exactly those families that were not able to get the stimulus, did not able to get unemployment, to help them with rent, utilities, medical, food.
Yeah. And
so that has really, and also foundations from Boston also came to help our community, and that's been really, that made a tremendous difference, because we know evictions. I think Bristol County, we have the highest eviction rate right now, from what I understand. It might be just New Bedford, but I know South Coast Legal Services are doing a lot of evictions, because what happened is a lot of people did not pay their rent, and that there could be no evictions, but now the evictions are taking place, and now they're going to housing court.
It seems to me too, the pandemic has, and you kind of touched upon it earlier, has shown that there are gaps in the system.
Yes.
In a lot of, well, I'm saying system in general, but in a lot of the systems. Are you optimistic some of those can be addressed? And I don't know, are they city gaps? Are they state
federal.
gaps? They're federal gaps.
This is a federal issue. The problem we've been talking about for over 20, I know I've been talking about this for over 20-something years. What we need, we need at a federal level. So what we actually need is, like I've said before, we need an immigration reform bill. An immigration reform bill, what it will do, it would allow these 11 million throughout the United States. I think in New Bedford we got close to 12,000, if not even more than that now, of people who have no status, and they're stuck. So there's no path for them to start a legalization process. So what an immigration reform do, it would create this process, right? We know that this is, I know that during Bush's era, that there was a bill at the table. There was the Gang of Eight, I think it was. I know Senator McCain was the late Senator McCain. Kennedy was very
and Bush, they were all in favor
That's right.
of it.
They were all in favor.
President Bush.
Exactly. And it passed the Senate, but it did not pass the House,
Correct.
right? And so we got stuck and nothing happened, right? So here now again, and what's interesting is now we have President Biden, right? And so everyone thought, and a lot of people who are undocumented felt this way, because I got a lot of calls on this, felt, oh my God, now we have President Biden, now we're going to breathe better, now we're going to have an immigration reform bill, which that's not the way it works, right? What I actually think that will happen will be a DREAM Act. What is the DREAM Act? The DREAM Act is a path for DACA, which
Right.
is the Deferred Action for Childhood Arrivals, which is President Obama passed so they wouldn't be deporting students. That was the reason why he passed that
Right.
as an executive order. So what that would eventually do is the DREAM Act would allow those DACA to eventually get a green card. That's what the DREAM Act is. And so I think that there's a lot more support with both with the Republicans to pass something like that, but not an immigration reform, because we need 10 Republican senators in the Senate, 10
Right,
senators,
60 of them.
exactly,
Yep.
to pass an immigration reform. As we can see, nothing's going to happen. So it's just like there's a lot of miscommunication, and a lot of times it's very confusing for people to understand that. So we started getting calls right after Biden. Okay, when can I start my legalization process? It doesn't work
Right.
that way. And that's why then they easily become victims of scams.
Talk a little bit, because you and I were talking on the phone about the vaccine.
Yes.
And I know Damone has been in here, and Cheryl Bartlett actually was in here, and this is, I mean, your constituency is the ones that they need to convince to get the vaccine. So how do you do it? How do you convince them? What are you saying to them?
Okay.
Because they're the ones that Damone is worried, they're skeptical.
Mm-hmm.
And it's easy, because he was telling me, he's like, we need to do a PSA, but Jim, you're not the one we want doing it. You're not the one that's going to do it. So how do you do it, and what do you say to them?
First of all, you get doctors who are trusted members of this population, right? Portuguese doctors, Cape Verdean doctors, Spanish doctors, to talk about and go on, do a PSA, do any of that, and talk about the importance of the vaccine, having them, because that's who they're going to trust, is doctors. And there's just statistics on that says they trust doctors. So if you get doctors talking about that, you get the priests of these ethnic churches talking about the importance of the vaccine, even if it shows them getting the vaccine, right? Even at the church, get vaccinated on the church. Really start talking about the importance of that vaccine, but it has to be done at a grassroots level. It can't be done, perfect example, you can't have the vaccines, they're not going to go to Dartmouth or get online to get a vaccine. We got to bring the vaccines to them, just like we did with the testing.
So
right?
you're talking in the church parking lots.
Exactly, church parking lots. At the Immigrants Assistance Center, we had 4 times testing that immigrant. So why? It's right in the middle of the community. It's a trusted organization. Our neighbors are our clients. They're able to come and get the vaccine, and they see people whom they trust saying it's safe.
Why do you think they're skeptical? If I'm telling them, or if you're not telling them, if I'm saying get the vaccine, why is there that distrust?
It's a culture thing. It goes back to a culture, and it's a lot easier to understand the language than to understand the culture. So it's like the vaccines. It's a lot of times in their countries, the vaccines they were not, probably didn't exist, or maybe there was some mistrust with the vaccines, and so that is where. So it's a culture. It comes back from a culture. So that's why a lot of work needs to be done to convince this population about the vaccine, and you need to bring it to a level where they're at, and they need to hear from people whom they trust, and doctors, priests, members of the work with the community, people whom they trust is how you're going to get this vaccine. And the ethnic media, right? You got to involve the ethnic media, not social media, but involve radio and television. Why? It's great to translate, but sometimes a lot of things get translated at a level that they don't understand. So it's very important that it's got to be simple and easy.
Has social media been in? I mean, we can get into a discussion about social media, but has, for the most part, have your clientele, in a sense, have they really looked at social media? Do they trust social media?
The younger ones do.
Okay.
The younger ones, I'd say the younger ones, but I would say that even with families, I think that they rely a lot is on regular TV and radio still.
Got a couple minutes left. I want to, from your standpoint, from what you've learned from the pandemic, how do you think the pandemic will change your mission, your organization's mission, and how executing it?
Okay, first of all, I don't think Zoom's going away.
And you and I were saying, like you were saying, I'm kind of tired of Zoom right now.
Zoomed out. I am zoomed out. Yeah, I don't think it's going to go away. I think what is going to happen is going to allow us to expand. Like we're in the middle of a strategic plan, and we're very thrilled because there's a lot of things in that. The strategic plan is something that we really haven't been able to implement, but we are in the process of doing that. So I would say ESOL classes, right? Our ESOL classes have always been in person. So what we'll do is we're going to be expanding our ESOL classes. I think we're going to be doing a lot more workshops. And I'd say that was probably what was already in the plan, but I would say the COVID has allowed us to expand our services.
Is that good, bad, indifferent? Because, again, your organization is known as personable. I mean, face-to-face.
We will continue to be, but I think we will expand it in a way that we're not ever going to get away from that direct services. That is who we are, right? And especially with our population. But I think as the population changes, I think we also want to make sure that we're able to offer some of our services. So, for example, instead of doing one-on-one, do about the process of citizenship, right? It's just an example.
Yep.
Well, if I can do a workshop and do all about citizenship, and I can get people, and I can do a Zoom and do a talk all about
a lot of people on
exactly.
Yeah, exactly. Yeah.
Or if we're doing an emergency family preparedness, right? Like I just did last night with the school department. So if I do that, I'm able to create a workshop with emergency family preparedness. Then I can get more people the information.
Right.
So it's about actually expanding a lot of the work that we do, but creating workshops so that we will be able to reach more people.
Sounds good. For people who have questions, dilemmas, issues, and they need to get in touch with you or the staff, how do they do it?
Well, you can call. We've been in the office from 8:30 till 4:30, Monday through Friday. You can call us at 508-996-8113, or they can go on our website, immigrantsassistancecenter.org, and there's a lot of information regarding our programs and services and how to get in. We do.
A good website.
Yeah.
Do you get a lot of people using it?
Yes.
Okay.
You get a lot of people using our website, and it's good because it's always updated, and a lot of times people get to know about the what's happening with the Immigrants Assistance Center and all the work we've been doing.
Sounds good. Good seeing you.
It was wonderful to see you.
Thanks for coming in.
Anytime.
We'll do it again.
Anytime.
That's going to do it for this edition of Our Conversation With. I'm Jim Marshall of the New Bedford Cable Network. Thanks for watching, and we'll talk to you again soon.